Good evening, everyone. This is Ryan Hoyme, aka MassageNerd, and this show is brought to you by our friends at Massage Magazine Insurance Plus. Massage Magazine has been exploring touch therapies for over 25 years and has used that industry knowledge to develop the best value liability insurance in the business. Welcome, everyone. This is Ryan Hoyme, aka MassageNerd. Tonight we have a special guest, Eeris Kallil. Did I pronounce that right?
Yes.
Yep. And we're going to be discussing cancer, breast cancer and massage then, right?
Right.
Yeah. So, so can you give us a little background and how you got involved in the massage field then?
Yeah, the massage field, right? Before oncology. Yeah. Actually, I'm one of those people who massage therapy is their first career, not second or third. So I started pretty young. I studied massage in Jerusalem and had a little private practice, and then moved to Boulder, Colorado in order to go to the massage school here. So I graduated in '88 and then developed a private practice here in Boulder. And in '99, I started teaching at BCMT. I taught Shiatsu, mainly Shiatsu movement, clinic supervision. And in 2001, when I developed my continuing education classes, I taught the breast cancer massage and what I call core alignment technique, which we can talk about another time. But I was teaching that, and I'm still teaching my two continuing education classes on and off privately, but I'm not teaching at the massage school anymore. And that's my history.
Okay. And there's still a little bit of static. If you could just move back a little bit. And okay, try that. Okay. Sorry. And what made you decide to specialize in oncology massage then?
Okay. You know, many people start a passion or a profession or a hobby or things they're passionate about just because they went through something or somebody close to them went through something. And for me, unfortunately, it was both. My mother died of breast cancer, and when a few years ago, my sister, my best friend, and myself, we had breast cancer. So once I recovered, I realized that there's so much to learn about the whole subject. And to be honest with you, I was working with cancer patients before I was diagnosed myself. And once I was diagnosed and I studied and researched and looked at all what's going on in the body and how massage can affect the person, I realized that, wow, there's so much to know and so much to be aware of. And I was a little horrified that, oh my God, I did all this to a cancer patient without knowing. So I realized that I wanted to put it out there, get the information out, what is breast cancer, especially how it affects the lymph system, and how to work with somebody who has compromised lymph system. So I developed a class.
Yep. And how long ago did you develop that class then?
That was 10 years ago. No, it was 2000. It's already 13. So 12 years ago. Right after I had my breast cancer in 2000, and back then it was still kind of, the oncology massage was still in the gray area. You know, people were shying away from working with cancer patients, and I felt like it's time to get massage therapists more comfortable with the whole subject, because I'm kind of going off of your question here, but when I was going through my cancer and my treatment, I didn't receive a lot of body work. And in hindsight, I realized how helpful it could have been. And but on the other hand, I don't think I would have liked to be receiving massages from just anybody. So I thought that it was very, very important to start teaching people about breast cancer.
Yeah.
That was,
Definitely.
if I go off the question, please remind me to.
Yeah. Yeah, and there's still quite a bit of static, though.
Oh. What can I do?
Okay. Yeah, just farther away. Yep. Yeah. Yeah, because I remember back in 1997 when I went through massage school, it was basically you could not touch anybody that had cancer or anything else. I mean, it was very, just because there wasn't a lot of research. And when did you start seeing some research and stuff with cancer and massage?
I think right around the 2000, 2001, it started to be more less a taboo. And I know, but I did not know much about. I didn't know about Gail McDonald's, and I've heard of Tracy Walton when I was developing my class, and but it was kind of in the background. It wasn't as I think those names are now, whenever you want to learn about oncology massage, those two names pop up right away. But 10 years ago, it was still just beginning.
Yeah, because I even remember all the stigmas even with pregnancy massage and everything else, and had to get permission for every little thing and stuff, it seemed like. And so you've seen it change a lot throughout all the years then.
Oh, absolutely. When I was in the oncology conference just past weekend, you hear about people who work in hospital. Here in Boulder, it's no wonder. Boulder is very progressive. So we've had massage. When I had my mastectomy, I had a massage at the hospital. So that was already 12 years ago. They had massage, but not necessarily an oncology massage department. And now there's centers that are specialized for cancer care, but the holistic side of cancer care, not necessarily come here, get your chemotherapy and your radiation, but here what else you can do. You can get acupuncture, massage, Reiki. So there are more and more the centers that are dedicated to people with cancer to make this journey as easy and as what's the word? I can't say pleasant, but to make the people feel nurtured, because so much is depleted out of them when they go through those treatments.
Yep, and also too, is there a big difference between regular massage and oncology massage? And is there any real big difference then, would you say?
Absolutely. And that's the main reason is that it's not a healthy person that is walking into your office, right, that needs their deep sports massage. You see a person that was just diagnosed with a fatal disease. So it starts with the emotional component. People are under shock. So, and then it goes on with the treatment, which we all know how harsh chemotherapy can be, how devastating radiation can be. And they go from doctors to doctors to doctors to doctors, and not necessarily hearing any good news. But when they come to a massage therapist, that's their little haven. That's their little respite place where they can relax, take their guards off, and really let go. So it's different because a person needs to be really attentive to the emotional being, and that's not to talk about the adjustments you have to do in regards to pressure. If there's, like I said, there's lymph nodes involvement or removal, deep pressure is contraindicated. So there's a lot of contraindications that if you don't really pay attention, there could be a lot of, you can damage somebody and cause lymphedema, or they can go in through, they're already suffering from the side effects of chemotherapy, and if they come and get a massage and you work a little too deep or too fast or too long, they can have a reaction after, and it could be very unpleasant. So you have to be very attentive to where they are, where they're at in the progression of their treatment. And of course, a person that is newly diagnosed, a person that is in the midst of their treatment, and a person that is like 10 years after post-diagnosis, the massage can be very different.
Yeah, there's so many different things you got to be aware of too, and one question a lot of people have too is chemotherapy. I mean, when do you massage somebody that's on chemotherapy? When do you not? And do you actually use gloves then? And
that's a big question. When I tell my clients, I like to see my clients come right before their next chemotherapy session. So sometimes they get it once every 3 weeks, sometimes every 2 weeks, and it depends. If it's a client who comes once a week, I try to wait about 3 to 4 days after, then it's ideal to come just before the next one. Now, do I work with gloves? No. Again, it's very unlikely that chemotherapy is excreted through the skin. And I think there's a couple drugs that are. And then if you are vulnerable yourself, if you're sensitive to drugs, if pregnant, then it's important to put gloves on. But otherwise, it's okay to work on somebody right after chemo or a few days after chemo. I know that in the conference, there's a lot of people who work on people right when they're getting their treatment. They come and massage their feet and their hands and trying to make this experience as bearable as it can be.
Yep. Yeah, and do you think we should try your other microphone just to make sure?
The one with the headphones?
Yeah.
If it's terrible?
Yeah, just to make sure. Because it just goes in and out with the static. And
oh. Can you hear me?
Yep.
Can you hear me better?
Okay. Okay. Try it again. Yep.
How about now?
Yeah, let's try that.
I can't hear you. Can you hear me?
Yep. Can you hear me?
Yeah, I don't think I changed anything. How about now?
Yep. Can you hear me?
No, I can't hear you. How about now?
Yep.
Can't hear you. How about now?
Yep.
So I hear you through my speaker, not through this.
Okay.
Did it change?
Not really, no.
Mm.
Yep. Yep.
Let's take it out. So you suggest that we continue, or?
Yeah, we can try. Or can you maybe go the other way a little bit to just angle your computer maybe, or there's some kind of interference too? And
other way, this way?
Yeah.
Okay.
Okay, try talking now.
Talking?
Okay.
Yeah.
Yep, let's go with that. Okay, sorry. Yeah. And then what kind of classes did you attend then at the summit then?
Okay, what did I attend? I took a class from, Tracy Walton was supposed to teach it, but somebody else, she was sick, so somebody else taught that one. No, she did teach the one with the myth and research and massage, and that was pretty interesting to learn that. You know, we all say that massage increases circulation or increases the release of endorphin or increases the immune system, and research showed that actually not. So it was very interesting. But she said also that, you know, there's the clinical evidence, but then there's anecdotal, and, you know, people do talk about feeling stronger and healthier when they get massages. So, you know, maybe weren't able to give a scientific proof, but I think what people say is as important. What else did I take? I took a class about adhesion, another kind of surprising class where I don't think I can repeat what Susan said quite well, but she basically said that let's say lymphedema is a result of adhesions, and it's not a result of so if we actually go deeper than we think we should, it can release adhesions and will prevent lymphedema. So that was quite a new way to think about how to work with in my work, because it completely contradicts what we've been emphasizing so far. The lighter pressure, don't stroke towards the axilla where lymph nodes will remove. So it was very interesting.
And can you see, like 10 years down the road, all of that we know right now being changed now too, with because there's so much research and everything else that's going on out there? And
I would say so. I have no idea which way it will go, but I see that our world, the massage therapy world, is just leaping in huge steps toward being recognized as not a luxury, but a preventative health care. I see it going that way, you know, because in Boulder it's very, very prevalent that massage therapy everybody has a massage therapist here in Boulder. Even the doctors and the lawyers, and so it's really part of people's life, massage therapy.
And why is that in Boulder? Why just because the Boulder Massage School has been around for a long time then, or why is massage so prevalent in that area?
Well, it's a good question. I think people are attracted to this town because there's a lot of people that are aware of health and trying to live healthy, get off the fast lane grid, and you know, more conscious living. So I think that contributes to this awareness. There's quite a few of Hindu centers and Buddhist centers. So it's people who are looking for something beyond the mundane of going to work and make a living and live a life of stress. They're looking for something more than that. So there's a lot of seekers of truth, I think, in this town, and people that are very active. It's a total outdoorsy town. You'll see people as soon as the sun is out, even if the snow is still on the ground, people are jogging and hiking, and so there's a lot of body awareness, body and mind awareness, and people are just, it attracts more and more people like that, you know.
Yeah, because one of my main mentors that lives in the city where I live, she actually graduated from there too and stuff, and she said a lot of those kind of things, and she kind of joked that there's a massage therapist on every corner there. So
yeah, it is. It's true. First thing, I think my husband.
Okay.
Oh, we might have a mic. Just walk in, Stewie. But can you help me figure out where to see? This is it. How about, can you hear me?
The same.
The same.
Oh, here, put it here.
I don't think it changed anything. I don't think.
Oh, so it's.
I don't know if it's the right.
Does that say
plug.
Microphone there?
It's very hard to see.
It is.
Oh. Sorry.
No problem. It's live. Anything can happen.
Yes.
It is the mic, so it might not work.
All the way in. Does that work better?
Ryan.
Yep.
Did that change anything?
Did it change anything?
Nope.
No. I think my mic just doesn't work.
Yeah, it doesn't. Sorry. I
Yeah.
could.
Yeah. What's this? Oh, okay.
Okay. We'll make it work. So. And then is there a lot of specialized training in Boulder then?
Specialized training? What do you mean?
Like oncology massage or?
Well, I know. Well, I have my classes that I teach, and I teach mostly in Boulder. I would like to expand and go national and international. So I teach my massage and breast cancer. I know Lauren Kate Mauser comes to the Boulder College of Massage Therapy to teach occasionally. So we bring people here. I think in terms of oncology massage, it's me and maybe another woman who's teaching the lymphatic. Oh, there's a lymphatic massage school, the Close Institute. So, yeah, there's a lot happening here, but sometimes we bring people from out of town.
Okay. And can anyone work with oncology patients, or do you have to have specialized training, would you say?
I think it's very important to have special training because just like I said earlier, if you have a client with compromised lymph system, you need to know how to work with the lymph system so you don't, you're not facilitating any lymphedema. You know, if somebody doesn't have lymphedema, it can happen anytime, even 10 years after the actual treatment. So you want to be very, very careful. You want to know what you're doing when you're working with cancer patients. Also, in my case, in terms of massage and breast cancer, if you have a client that comes in and tells you, "Oh, I just had a mastectomy, I had a tramp flap, and I take tamoxifen." So it's really helpful if the massage therapist knows, "Oh, I know what that means. I know that you had more than just mastectomy because they took a muscle out of your belly and they flipped it over to make a breast out of it. So there's a scar in the belly, there's scars on the chest. So I know what's happening in your body when you tell me this." So there's a lot to know, and I think we can give. We are also, as massage therapists or oncology massage therapists, we are educators to our clients. Sometimes they don't know what's good for them and what they need to be careful. Many of my clients have no idea that they need to be careful with of lymphedema, that they shouldn't get their blood drawn on the side, they shouldn't get acupuncture. Many clients, the doctors don't tell them. So we have a very special role in educating our clients. And it's really, when the client comes to see me, usually they're overwhelmed and they're a very fragile state. And the more knowledge I have, the better I can guide them through this whole process with clarity in making decisions. There are huge decisions to make: lumpectomy, mastectomy, yes chemo, no chemo, yes hormonal, no hormonal. Now that I'm their doctor, of course, their doctors are there to give them guidance. But when they come to see me, they're so overwhelmed with all this information. So I see my role here is just to provide them space for clarity. So they get all this information. They're the only people who can make those decisions. I'm not helping them make the decision, but I provide them space so they can relax, they can collect themselves, and process everything together. So back to answer your question, I think it's very important that somebody knows what to do and what they're going through, what drugs they're on, how the drugs affect them, how can I adjust my pressure to be okay with saying, you know what, it's not good for you to have deep pressure. I'm going to go light in this area. Because many people, if they don't feel the massage, they think they wasted their money, right? But we have to be educated to feel comfortable to say no. You know, I know that it's better for you to receive a lighter massage in the long run. Yeah.
Yeah. And have you ever had to refuse a client to get a massage then, because of certain kind of complications or something with cancer?
No, I have not refused a client. I have had to tell people that I'm not going to go deep, that I'm going to stay on the light side. And, you know, initially they're not very happy. But eventually they realize, yeah, I think almost every time they said, well, I know, I trusted you and I agree with you. It felt, whatever you did felt good. And I'm glad you told me. So in my experience, I never said no to anybody, because you can always just hold their hand or hold points on their feet. And that's sometimes all you can do with some people.
Yeah, definitely. I mean, just the power of just touch. I mean, you don't even have to massage. And do you get into like energy work too and stuff with cancer patients, or?
Yeah, the style that I developed for myself is actually a combination. I call it Intuatsu. It comes from intuition and shiatsu, where I assess the belly, the hara, and find out which meridians I need to adjust. And then I will combine lymph massage along with meridian work, along with some massage work. And it works really, really well, because the understanding of the Eastern medicine, the Chinese medicine, helps me to listen to their body deeper than just what they're telling me. And I always ask ask for not just what you want to work on physically, but also what would you like to work on personally? What changes you need to make in your life that I can assist you in stepping forward in making those changes. So they make what we call a little dedication. And as I'm working with them, I'm also talking them through and bringing affirmations and visualization. Depend on the client, of course, the people who are open to it, and people who are more not new agey per se. I still do this work, and they love it, but I don't suggest too much. I'm just letting the work do what it needs to do without talking too much.
And do you get into aromatherapy too then, or?
A little bit. I'm not an expert in aromatherapy. That was a class that was offered at the Oncology conference, which I wanted to take, but I couldn't because I did something else. But I do use some aromatherapy, but I can't say that this is my strong side. I enjoy, and I mix a little heart chakra mixture, which everybody loves, so I use that a lot. But you have to be careful with aromatherapy too, because people who are going through chemotherapy can be very, very sensitive, and it may not feel good. And they also get attached to the smell. So if I work with aromatherapy and after they're done with a session, if I will introduce that same smell again, they might have a reaction, an adverse reaction to it. So you gotta be careful. But it's all about communication. You really have to communicate with your clients all the time. See what makes them feel good, what's challenging, what we need to change for the next time. There's a lot of trial and error. I can't claim that I know it all, that I am always giving a perfect massage. But if the two sides, the client and the therapist, are willing to learn from their mistakes, there's a lot of learning on both sides, which is beautiful. Really, it's a win-win relationship.
Yeah. And is there a lot of specialties in oncology massage then too?
What do you mean specialties?
I mean, like with breast cancer, do you know other therapists that specialize in different kinds of cancer or different areas of the body, or?
Yeah, I'm not sure. I know that there's like Lauren Kate's Mauser. She works a lot with people, or she teaches classes for the end of life. So that's another aspect of more of this spiritual, emotional support. I'm not sure. I know of a couple people who specialize on maybe scar work, or definitely the area of breast cancer. I feel like the breast cancer is such a huge I don't know what to say, subject, right? That there's so much to learn about the breast cancer itself, the different type of reconstruction, drugs that they're taking. So there's a lot to know about working with breast cancer patients.
Yeah, there's definitely a lot going on and stuff. And do you actually massage? Let's say a woman had their breast removed from a mastectomy and stuff like that. So do you massage that area afterwards too? Then? And
absolutely, with her permission, of course.
Mm-hmm.
But the more movement, the better. It depends on what surgery she had. There's many different styles of reconstruction, and the most important thing is to loosen the area so it doesn't get hard. It can get really hard and very uncomfortable if the person is standing, tends to develop serious scar tissue. So the sooner you're able to start working on this area, the better.
Definitely. And then, what kind of things do you cover in your classes then?
I have my list so I don't forget. Okay, so I cover facts about breast cancer, risk, symptoms, pathology, and different diagnoses. We talk about modes of conventional treatment, so I talk about all the different reconstructions. We talk about radiation and chemotherapy, and as well as some alternative treatments. I give some nutritional facts and different, they call CAM methods, the complementary alternative medicine. We definitely work on hands-on technique, which I emphasize. I talk about the lymph system and emphasize. I do teach how to work with the lymph system, but this is not an NLP class. It's just enough information so a person can safely work with a breast cancer patient. So just learning basic tools to be safe, and that's very important, specifically with breast cancer or any other cancer where lymph nodes are removed. So I teach about that, as well as some very specific techniques that help with bringing range of motion back. After mastectomy, the muscles are very tight, the arm loses range of motion, the whole torso can lose range of motion. So I have a few specific techniques that work with that range of motion and scar work. I also talk about the emotional aspects of dealing with breast cancer, and I teach some guided visualization and meditation. And the last part of my workshop is when we bring volunteers or breast cancer survivors and they sit and tell us their story. And after that, we work with them, the students work with those survivors. And whenever I get feedback forms back, everybody's talking about the panel with the survivors. Because just hearing the stories it's amazing. It's the best teaching skills that you can ever have because you learn so much from those stories. And when we first start the class, I teach a lot about the medical aspect of breast cancer, and people look at me like, "Yeah, really? Do we really need to know all this?" And it's a little mind-boggling because it's a lot of information. But once those people, the survivors come in front of us and they start using those terms, "Oh, I'm on tamoxifen, I had a lumpectomy, or I had reconstruction with the lap flap," the students realize, oh yeah, that's what we needed to know all about this. So it all comes together at that last part of the session, the workshop, and it's just beautiful.
And how long is the workshop then?
2 days.
2 days, okay. So you mostly teach in that area, but you have taught other places then too, or?
I've taught in Chicago, and I hope to go back there again, and I'm hoping to develop some relationship with massage schools in Israel, where I'm from, and they're very excited and open to it. It's just need to start working the details.
How popular is massage over in Israel then?
It's extremely popular. The reason I came here in '86 was there was no decent massage school. Now there's like almost every other corner there's a massage school. So it's amazing how Israel is such a small country that it feels like Boulder. There's a massage therapist every other corner, just like here.
Is there a lot of regulation with massage over there then too, or?
I don't think so, but no, I haven't been there professionally in so many years that I really don't know. I have to find out.
Yeah. And is there a certain style of massage that's mostly practiced over there?
Yeah, I think reflexology, Reiki, and Shiatsu. That's the most popular. Those are the most popular styles. But of course, the deep tissue and the other massages for sure. But this is the most popular.
Yeah, it's so nice that other countries and stuff are really getting into massage a lot more nowadays, and because I mean, I think we're kind of sheltered over here. We think we're the major area of concentration of massage and stuff. But last year I was in the Philippines, and reflexology was huge there. So that was our main modality, it seemed, and stuff. And,
wow! Yeah.
Yeah. Yep. And then. Are you going to be developing any other classes in the near future, would you say?
I'm thinking about it. You know, I'm thinking about my Shiatsu, and but this will be, I have to think about it because it will be geared to very specific student body, because people have to know about the meridians, where they're located, and what they're, you know, how they affect the body. So it will be a very specific crowd that it will be geared to. So I'm not sure if I'll go there, but I would love to teach that, because I think it works so well for my clients, and I would like to share that. I do have the core alignment technique, which is body work that is inspired by, but not Feldenkrais. It's not Feldenkrais, but it's inspired by a specific exercise of Feldenkrais, which through the years I added shiatsu stretches to it, and energetic components. So it's mostly done in side position. So, you know, when you go to massage school, you basically learn front and back, supine, pro, and not a lot in side position. But when you add that dimension, it opens up a whole new way to work with the body. And it's a technique that can be added during your massage. You can do a little core alignment, or you can do it on its own for a whole hour and a half or hour and 15 minutes. So I'm working with that and teaching that. And that's it for now. I'd like to continue to teach shiatsu very soon, but we'll see where, you know, where opportunity will open itself to teach that more.
Yep. And are you NCB TMB approved provider then?
Yeah, I am.
Okay.
Approved that 4 years ago, or yeah. Before that, I was teaching through the Boulder Massage School, so I was an approved instructor through that. And then when I left, I applied for being an approved provider.
Okay. And then what are your goals for the future then?
So I already kind of touched on that, is teaching, more teaching. I love teaching. I really, I really love sharing the knowledge and helping people who are discovering this field. And another goal that I'm it's just starting to brew. It's been brewing in the back of my mind for a long time, and now I'm almost 50, and I feel like, okay, I've been giving my life and family the time, and now it's time to give back to the community. So I want to create a fund. I'm going to call it my sister's fund. It's after my sister who passed away, and so I can give body work to people who for free or at very low cost. So this is my goal that I'm starting to cook and starting to see how I can make it happen. So it will be a non-profit, of course.
Oh, that sounds like an awesome idea.
Yeah, I really want it to happen. So I'm starting to work on it.
Yeah, and if one already has oncology training, why should they take your class?
That's a good question. You know, I went to this oncology conference and I realized, wow, I've been in this field for so many years, like more than 25 years in massage and 10 years in oncology, and I still feel like I know nothing. I still feel like I can learn so much more. So there's never enough work, enough studying, really. And even if you go to a class where you've already heard some stuff, hearing it again could be empowering. And you'll always learn something new. So that's one thing. But my class is different because it really is specialized for breast cancer. And I was going to say, I don't know if it's true, but in my practice anyway, my practice is mostly, I have mostly women clients, female clients. And obviously, breast cancer is more prominent in women. Of course, men get that too, but not as common. So if you haven't had a client with breast cancer yet in your practice, either you're very young and starting, and I guarantee that you probably will run into somebody very soon. So it's becoming part of life. One in every 8 women get breast cancer. So I'm sure that a massage therapist in their career will run into a breast cancer patient. So it's very important to know what you're doing. So in my class versus just a general oncology, you'll go into very deep detail about breast cancer, deep details about different reconstruction, and then how to work with the lymph system. The basic oncology classes don't teach a lot about the lymph system. And again, I'm not teaching it to be, a person cannot say, oh, I know how to do lymph massage. No. But it gives you enough tools to know what you're doing. And then I do spend quite a lot of time teaching very specific hands-on. And in other oncology massage classes that I've taken, they basically tell you that you can use what you already know and just modify the pressure. And so in my class, people learn some very specific technique, how to work with the peg that they installed an implant. Usually when the reconstruction is done with an implant, they insert it under the peg, so that causes the peg to be very tight. Or there's a phenomenon called cording due to lymph node removal from the armpit, and that can be very uncomfortable. So you learn how to work with that. So very, very specific hands-on. That's how different it is, and more into detail.
Yep. And then with the regular massage schools, you really don't hear much about them teaching anything with oncology massage and stuff, and they might just talk about it briefly and stuff. But have you heard of any actual massage schools, like with the diploma program, going into more depth on oncology at all?
Yeah. Actually, in Colorado, there's the Colorado Healing Art School. I think that's what it is. They're working on certification in oncology massage. At BCMT, they have like continuing education classes that they offer. And I know So that's what I know in Colorado. And I assume Gail and Tracy have their program for certification. Gail McDonald and Tracy. I always want to call him Tracy Chapman.
Yeah. Yeah. Tracy Walton, yeah. Yeah.
So I think it's coming. It's coming.
Yeah. And do you see it more getting into hospitals then too for oncology massage? And
Absolutely. Yeah. And actually, when I taught in Chicago, a lot of the students actually studied oncology massage in a hospital setting. So it's definitely coming there too.
yeah, it has to. I mean, it has to branch out so much more and stuff. And I mean, it's getting there, but
It is.
yeah.
Yes. And actually more rapidly now than ever before. So it's really, really changing fast.
And do you think we have to educate doctors in a way too about it? Just because, I mean, a lot of doctors I've talked to in the past, I mean, they said, "Oh, no problem to get a massage, no problem, anytime," and stuff like that. And they think massage can't do any harm at all sometimes. But do you think we have to educate them more, or show more studies then, or?
I think so. You know, like I said, some clients come to see me and they haven't heard, the doctors didn't even tell them about lymphedema. You know, that if they do the radiation or lymph node removal, they can develop that suddenly their arm swells up and they freak out. They don't know what happened. They were never warned. So the doctors are not even, you know, they just go and do what they know. If it's a little beyond their scope, they're not even interested. So I think it's very important that we go out there and educate the doctors. Absolutely.
Yeah. And do you think you'll ever write a book in the future, or do any DVDs, or?
Yeah, I definitely want to do DVDs. Writing a book is a little challenging for me, but I would love to work on DVDs. My husband and I are talking about that, and one of these days.
Yep. And do you think it would be more on breast cancer massage then too, or?
Yeah, I think I want to stay in that area, because it is what I feel like I'm called for. The breast cancer massage, absolutely.
And when is your are you going to any massage conferences this year?
I already came back from the S4OM Oncology Healing Summit, and that was just invaluable. Just going and meeting the leaders of the industry, of the field, and meeting people that are passionate about oncology massage as you are. It's very heartwarming. And I will definitely continue to go to conferences and take classes. I'm looking forward to Lauren's class here in Boulder, the end of life class. And and like I said, there's never enough to learn.
Yep, definitely. And it seems like so many oncology therapists get along so great too. I mean, they're even sharing each other's information, and they talk well about the other ones. So it doesn't seem as competitive nature as other specialties sometimes.
Yeah, I'm not sure about how it is outside of oncology so much, but yeah, there's a lot of sharing and a lot of love and a lot of appreciation to what we do, and I think it's very important and beautiful. Yeah. That, yeah, I think we come from a very humble place, and I don't know if humble is the word, but very giving, because we deal with with clients who are touching on the preciousness of life. It's suddenly you realize when you have a diagnosis like that, you realize that your life cannot go back to where it was before. You can't just take anything for granted anymore. So everything is very precious, and everything is very holy. I don't know if I'm pronouncing it right. Holly.
Yep, holy. Yep.
Holy.
Yep.
Yeah, some words I have difficulty with. So I think we don't have time for greediness and holding on to knowledge. It's too important to share.
Yep. And what can anything else we can expect from you in the future then?
Anything else? I'm not sure. I think I really I'm looking forward to making videos, to get on the road with more classes, and that's for now. That's my goal. I still raise 2 teenagers at home, so my attention is very much feel at home as long as my private practice. But they're leaving home in a year, so I think I'll have the empty nest syndrome and I'll be a workaholic.
Okay.
Not that I'm not now, but
yeah.
More of it.
And what's the best way for people to get a hold of you then?
I have a website. It's bodyworkwisdom.com. And there you'll find all my information, phone number, email. Shall I spell it out or?
Yeah, please.
So the phone number is 303-775-8005. And my email is my name, EERIS KALLIL @AOL.com.
Okay, cool. Well, thank you very much, Eeris.
You are very welcome. Thank you, Ryan. Yep. And I wanted to thank you, too, for everything you do for our field, to bring people out there and doing what you do.
Oh, thank you. Yep. And then we'll see you again, what is it, in a couple months, I think, again?
Right. Something about core alignment.
Yep, definitely. Yep. Thank you very much.
Thank you, Ryan.
Yep. Thanks, everyone.